Hey everyone, welcome to another episode of the Standards and Training Committee's podcast, Interpreting in Healthcare, sponsored by the National Council on Interpreting in Healthcare, the NCIHC. Today, we have an international guest and someone that I am so pleased to have join us in terms of the depth of her experience and expertise and her on point observations about what is going on right now. So, our guest today is Susana Bernardo. Susana is a PhD researcher in translation studies for the Foundation for Science and Technology at the University of Coimbra in Portugal. She is a member of CELGA ILTEC, CELGA-ILTEC, the Center for General and Applied Linguistic Studies, which supported her recent fieldwork in the US. She obtained the title of Specialist in Foreign Languages and Literatures / Translation and holds a master's degree in translation. She's been a specialized translator from English and German into Portuguese for multinational companies in healthcare, technology, and marketing for 25 years, and is currently teaching specialized translation in the Masters in Translations program at the University of Coimbra. Susana is completing her own PhD in translation studies, writing a thesis to be more accurate. She is also teaching and organizing events at the University of Coimbra and still doing translation and revision projects for longtime customers. And I just have to add, when was University of Coimbra founded? 1290, is that right? 1290?
You're absolutely correct.
Oh my goodness. Here in the US, we are impressed with things that are more than 100 years old. And it is always so emotional for me when I go to Europe and I see places that are still standing that are more than 1,000 years old. So, welcome to our nascent podcast, Susan. I'm so glad you could join us today.
Thank you so much for inviting me, Eliana. It's so good to be here participating in this wonderful podcast. Um, well, I don't know if you have questions for me or if I
Yes, I
should just
do.
start.
Well, we've both been doing this for a while, so I'm going to start by looking back. Was there a
Okay.
moment when you look back that either makes you feel very proud or is a moment that stands out to you that was either when you decided that this would be your career or when everything clicked and you knew that you were in the right place? Like, what was it about language access that drew you to it to do it professionally for the rest of your life? Looking back on it, what is it that sticks out? What are you proud of?
Well, I guess that apart from my initial interest and motivation for languages and cultures, it all started, the turning point was the fact that I started my collaboration with the US translation agency back in 2006. So I'd been working mainly in technical and marketing translation, have had a few experiences in healthcare, and this agency was looking for a Portuguese translator. So they worked with several languages, several language combinations, including Portuguese. So I worked remotely from Portugal for this agency based in the US for several end clients in the healthcare sector, so including healthcare, public health, and education. So this work was something that really fascinated me since the very beginning, because it was all very organized and professional, but at the same time, it was very flexible and open-minded. So translators were provided with clear, comprehensive information and language and culture-sensitive instructions. But we had an open channel of communication. We could raise questions and share our concerns about any issues. For example, from linguistic accuracy options in the medical field, or cultural nuances concerning the target audience, which was the Portuguese-speaking community in the US, mainly in Massachusetts. So actually, Portuguese, as you know, is the second most spoken language in the US after Spanish, according to the census report. So basically, this was really great, a great opportunity, because translators were mainly U.S. residents in this agency. I think I was one of the very few exceptions. And living in Portugal, I could clarify and discuss local details with my teammates that were living in the U.S., so immersed in the real context. Um, Also, the way we worked was very enriching, because we worked in pairs. So we always teamed up on translation assignments from English into Portuguese, both as lead translators or reviewers of each other's work. Um, and we did this remotely, as I said before, sometimes on tight deadlines, to be honest. And this required a high degree of effective communication and collaboration, but it worked just fine, because I guess we were all very much oriented towards the same goal, which was providing clear and inclusive healthcare information. So translating documents like informed consents, patient information brochures, instructions to prepare for medical exams. We also had medical guides, health programs, health unit services, leaflets, all these documents addressed to the vulnerable Portuguese patient community to promote their access to healthcare. And one fun fact, some of the Portuguese translators I'm telling you about were also healthcare providers and health communicators. So this added knowledge was so important. It meant a lot for everyone. We all share the Portuguese language and also a migrant background. I myself lived in Africa as a young child and moved to Portugal later on. So I found this common ground a very important motivation. We can all understand the needs so much better if we have a similar experience, I think. So the Portuguese community living in MA is very diverse. So many challenges. There were many challenges that we had to face. There are people from Portugal, from Brazil, which is the largest group, but also from Cape Verde and other African countries. So our linguistic and cultural competence was very much at stake, and we all loved the challenge. I think that being a rather small agency helped this proximity that we had, this very close relationship, even when working from across the pond, just like myself. Yeah, and this was really great. Also, the fact that I've always been in close contact with Isabel Pinto Franco. We met in college and have been friends ever since. She's a wonderful medical interpreter in the US, as you know. Yes. Um, and she has kindly shared her passion and her knowledge, her experience in this work she does at Cambridge Health Alliance. This has always fascinated me. Also, working with Jordan Coriza, yes, He is a major influence in my interest and sensitive approach to translation in healthcare. We have worked together many, many times, and he was always so generous in sharing his experience, his expertise in medical communication. So I guess I'm a lucky girl.
You
Yeah,
are. And you know,
I've
something
been working.
of all the things that you were talking about, something that jumped out at me was when you spoke of always working in pairs, in translation pairs, because that is such a way to advance your proficiency, I think, when you work with another qualified, certified, perhaps, partner in your language pair. It always makes you stronger. And I've always been jealous of the sign language interpreters because they tend to work in pairs. Every 30 minutes, they'll switch off. And I always wish, where's my partner? Because as a healthcare interpreter, it is very much a lone wolf kind of experience. And I wish I could impart that knowledge as well as that feeling of support, which also makes you do a better job, I think, to those language access program managers and directors who only see like, ooh, now I have to pay for another interpreter, or what do you mean we need two instead of just one? Because of the effect that it has on the quality, it is an inevitable effect that you support each other and both of you come out better than you would have even if you were working side by side in separate rooms. Um, and so I'm a little jealous. But I think we need to spread the word. Language program managers and supervisors and directors. There is so much that goes into it's not a Google Translate process. All of that nuance that's missing in AI for, reading the temperature in the room, sensing the amount of stress or concern or fear or anxiety, as well as being able to render the message as close to the original as possible when there's so much variation because the number of countries, of lusophone countries that exist, the variety and the small modifications. We were just talking about this before the podcast started. Um, as I was checking, in Brazil, we use this word for computer screen, and I notice in Europe they use this word in Portuguese for computer screen. What is most commonly used by you? Because we're always checking, we're always learning, we're always double checking and verifying. And as I tell my students, it's a lifelong process. You're never going to get to a point where you can say, okay, I've learned all the words, all the terms, because language is a living thing and it continues to evolve and add to itself and grow and develop, and new things are invented. So it's always a moving target. You're always running to stay current with the knowledge of the environment that you work in, the knowledge of the language, the slang, the updates, the new words that are added in the culture that accompanies those two languages that comprise your language pair. So, yes, I am jealous and I wish that consecutive and simultaneous spoken language interpreting could be able to be done in pairs. But also, this is our job to spread the word, as it were, to make people aware that certain processes can be done in a way that creates more satisfaction for everybody that's involved, including the ones that are doing the work of moving the one language A into language B. So that's why I wanted to just take a moment and call out and say, if you can work with a partner, you're always going to do a better job. You're always going to be able to verify. You're always going to be able to have, I think, less anxiety in the moment, because interpreting, unlike translation, is sort of like a performance art, right? Because it's live from New York. It's it's no time to refer to a source, no time to rehearse, no time to prepare. You hear that sentence and you have to interpret that sentence. So I think just for that reason, having a partner would ensure higher quality, higher accuracy, and less stress for everybody involved. So that's my little piece. And we'll get back to you, Susanna. So you were looking back on your good fortune of having met individuals that you learned a lot from when you partnered with them, the size of the agency that you worked with, and the camaraderie and work style that was developed that was successful. So, what made you decide to continue to pursue academically and professionally language access, translation, and currently, what are you working on?
Well, currently I'm finishing my PhD thesis, just like you said, which has been um, keeping me busy for the last 5 years. And I can tell you that I don't regret one single moment. It will always be a work in progress because this is a phenomenon that's always evolving. I think that currently countries are facing this problem of mass migration. And one of the biggest challenges is recognizing the importance of language access for healthcare providers and for patients to guarantee that everyone can receive healthcare. So this goal of healthcare for all, proclaimed by the United Nations and by the World Health Organization, can be achieved. So as a researcher and as a translator, this is also very important for me that I can feel I can contribute to this social impact. Um, this is very important. It's important that everyone understands the good health communication allows for better clinical results for the satisfaction of all parties involved in healthcare. The reduction of costs because you have better diagnosis, less unnecessary exams and consultations. So it's a win-win-win situation. And this big challenge is for me to spread the word and to make language access to healthcare a priority. And this should be a priority for governments, for policymakers to design and implement adequate models to address the issue, to allocate the necessary fundings to projects. For health institutions to value healthcare mediation in their policies and implement best practices. So creating translation departments or translation units within the existing communication departments and hiring professional translators and interpreters.
Mhm.
For universities, this is also a challenge. They need to design and offer adequate education to train students to become competent professionals. When I tell my students about this topic and this need, they are all very much motivated to learn. So we need to provide this offer, and also for training and certification bodies like NCIHC, and hopefully one Portuguese body that will emerge in the near future, hopefully, to encourage training and certification to promote the professionalization. So on the one hand, I think we should share what's being done all over the world, and many countries are addressing this problem in different ways. They're having institutional um, interventions and also civil society initiatives. So it's important that we share, we learn from each other. And I don't think that the one size fits all approach is the best solution. So we need to consider the nature of migration movements that is very diverse and is continuously changing. So the services provided need to constantly adapt, and this is not easy. Um, so I think the changing work requirements make it difficult to design and have a funded offer for training and certification programs, for example, that are standard, efficient, and at the same time adjusted to specific needs. This makes it difficult to prepare, educate, and clarify and certify professionals. It makes the translation and interpreting jobs less attractive, less recognized, paying less. And we need to break this cycle. We need to value the role of the mediator, so the translator and the interpreter, and we need to value the role played by translation in healthcare access. That's why I'm a big fan of NCIHC for all the work that you've been doing, the codes of ethics, the guidelines, the standards, along with other standards like the class standards, the IMIA standards, and others. We can explore this challenge as a starting point, all these standards as a good starting point, and combine the guiding principles with the specific requirements of each context. Um, that's why I think it's so important to answer your initial question to develop empirical based research from data collected from real situations to inform all these phenomena, these evolving training models and certification programs.
I agree. If we are going to get any movement and change at the top levels, we need metrics and data to support our assertions or our hypothesis of how things should be done. But I also think now more than ever, without getting into the weeds of politics, but given a time that is perceived to be more difficult for a variety of reasons, I think we need more unity across like-minded organizations that work in the language access environment to link arms and have more unity as a group. To perhaps we need to come together and create a small group to develop goals that we can all embrace. But then we need to be able to show up for each other, whether it's making phone calls or writing letters or showing up at events and educating people so that they in turn, the ripples, when you throw the rock in the pond, the ripples spread out. So the ripples touch other communities at different levels. Some of the better language access law that exists in the United States comes from small local communities that decided to make their park safer, or information about boating safety and lifeguards and swimming safety accessible to everybody that lived in the community and not just the English speakers. And I think we have a lot, again, if we collaborate, if we have a partner, we are that much stronger. And everybody has something they can bring to the table that the others haven't thought of. But we need to make the table. If we aren't invited to the big political table at the top levels of government, we set up our own temporary picnic table and invite everybody that works in the area to come together and brainstorm, because we're the ones that are doing the work, regardless of what the laws or intragovernmental agreements say. We are the ones doing the work. We could decide how to do the work better and share that amongst ourselves. And it's going to take a long time for the top to come down and for the middle and the bottom to be able to actually reach good understanding and agreement. But I don't think we have to wait for that. I think we can make things happen, and we just have to be willing to reach out a little bit further than we traditionally have, because the world is so big and so small at the same time. Fundamentally, we share all of the same needs to be heard, to be understood, and helping advance that, helping people reach those goals is something that everybody agrees on. So we just take away the name of the language, the name of the political party, and just work on being able to understand each other better. And part of that is not being in, we say in the US, in silos, in these little isolated towers. We need to open the door and invite other silo dwellers in for, a potluck dinner, and let's all get together and figure out how we can do this better, regardless of what the controlling interests are saying or doing. I really think we can move the needle, as it were, quite a bit on our own. And then it becomes inevitable because people, that's how they're doing it. So once you get people doing things, it's harder to undo them. So you get people used to realizing, oh, this person doesn't speak English well, so I need to call an interpreter. Or I only have this material in English, I really should get this translated. Well, let's pool our resources. Why does each hospital have to translate how to properly install your infant car seat? Why can't we have an archive where a well-done translation that has been vetted lives and people can go pull that for free? There's a lot of material that gets repeated, not specific patient care, but so much information in the healthcare world is generic, and we could agree on it rather than having people feel like, oh, I need to send this out and pay money to get it done. Let's make a free library where people can turn to get basic safety information, basic general patient information, things that you can pop in the date to the clinic is closed today and will reopen tomorrow, and you put in the date, but the rest is correct for that language. I really think we could help move people into regularly including language access and how they do their business. So I think part of the responsibility is up to us to reach out to new friends, to new allies, to places we haven't thought about going before. So, anyone listening to the podcast, if you have a roommate or a spouse or a sibling that works in IT and is working on AI for translation or interpreting, invite them to come meet us. We want friends in that world too. How else are we going to be able to share our concerns and help craft an excellent product rather than a so-so product? So that brings me to my next question, which is looking forward. What would you love to see happen, or what are you concerned about? You can go either way. Looking ahead to the future, what springs to view as the first thing that you are concerned about?
Well, I'm concerned about several things, just like I've said before, but I like to think it to think of it in a positive way. I'm an optimistic person. I like to think that things can change for the better, just like you said before, and that we all have a word to say and need to act. So I can share a bit about what we've been doing at the University of Coimbra to add to this. We've had several short courses, workshops, papers roundtable discussions on this interesting topic. We've had an intensive course of face-to-face interpreting, OPI, so over the phone, and VRI, interpreting, lectured by Isabel Pinto Franco. And this was the starting point. So awareness is being raised among students and scholars on this topic. And this is actually the starting point of a new interdisciplinary project called Bridges, Pontes in Portuguese, which is being developed within our research line, Bridging Communities, in the research center Selviltech. And this project aims to encourage meetings and debates between academia and professionals. So building on our PhD program in translation studies, on interdisciplinary projects on translation in legal and healthcare, and on my own research project, Intercultural and Interlinguistic Mediation in Healthcare Access, our work group, including Professors Conceição Carapinha, Cornélia Plag, Patricia Rossi, and myself, organized this first event in 2024, called Between Linguistic and Clinical Communities, where I facilitated this debate with several stakeholders, so a doctor from our maternity hospital in Coimbra, a social worker also from this maternity hospital, a medical interpreter, an OPI interpreter, the director of the Portuguese Migrant Integration Department, a foreign patient, and a researcher expert in specialized medical communication. From the Ghent research group in Spain. So our aims were to identify the problems and challenges of interlingual and intercultural communication in healthcare context, to listen to different stakeholders who interact in this field, and to encourage interaction, so collaboration, just like you were saying. And the outcomes were really great. We managed to outline a potential protocol between the University of Coimbra and the maternity hospital that we are preparing as we speak. A potential protocol between the master's degree in translation of the University in Coimbra and of the University in Spain, in Jaume I, a potential protocol with between Selviltech and the Ghent group, also in Spain, and also the production of resources. So producing the translation of critical documents for the maternity hospital, a best practice guide on mediated healthcare for healthcare providers as well. Also, we're working on interpreters training to establish an interdisciplinary training framework. We're planning awareness-raising actions on the importance of mediated healthcare for providers and hospital administration, and creating a pool of healthcare translators and interpreters, maybe initially on a volunteer basis, and later on we'll see. But like you say, we have to start somewhere, baby steps, and all working together. So I would love it if all of this could become true and happen soon, and that we can expand our work of providing professional interpreters and translators to promote healthcare access for all. So this is what I really would like to happen, hopefully.
Well, we're going to change that from what you hope would really happen to this will happen. It's just how fast can we make it happen, and what kind of quality can we build in, what kind of ongoing assessment can we build in to always keep improving? So
Mhm.
I am right now just happy to say anything you need from us as an organization in terms of resources, or from me personally in terms of helping move this project along, it's a worthwhile project, and I would love to see you come back to the podcast next year and say, we've launched, this project at this hospital, or this project at this clinic, or this is a protocol that is now being accepted widely, within our national health program. Let's think big.
Think big. I'm with you, and I appreciate your availability and your interest in being part of the challenge, because we will need you. Of course, we all need each other. And in the US, you've been developing, well, your age is ahead of us in terms of medical interpreting, so we have a lot to learn from you, and I'm very thankful for your availability and interest.
Well, the first pass is always the hardest, right? Blazing the trail, or as we say in Brazil, quebrando galho, getting through the jungle is
Yeah.
always toughest for the first few people that go through, but the subsequent travelers have a little bit easier time. So I'm really hoping to see you telling me all about successful implementation in a very short amount of time, as opposed to 20 years from now, which is how long it's taken. It was really the pandemic that threw the last resisting people, organizations, rural hospitals that said, no, no, we don't need interpreters, into the pool. That style of learning how to swim, your uncle throws you into the deep end of the pool. Not the best
And you
way
have to
to
survive.
learn.
Yeah.
But they went kicking and screaming during the coronavirus pandemic, because there was nothing more to offer than remote interpreting to fulfill those needs. And people found out, even though that was a rough way to get started, just thrown into it, that it worked. So once the pandemic, it's still out there in different mutating ways, but once life got a little bit more back to normal and people were back to work and not sheltering in place at home, that connection did not go back in the box. It stayed operational. I think once people experience it, they realize, no, I can't go back to either not using an interpreter, or using Google Translate, or waiting a long time for somebody and throwing off my schedule. The immediacy of the connection on the phone or the video means there's no excuse for people to go without language access.
Right. Absolutely.
So thank you so much for sharing your time and your experience and expertise with us today, and your vision for the future. It's good to be excited about the work that we do, because like I said, the guys at the top essentially don't matter in our day to day, and we are the ones that are in charge of our destiny. Let's make it a good one. Let's make it one that offers quality language access to everybody that needs it, without using the child interpreter in the family, without using
Yes.
Google Translate on your Apple Watch, but actually using a qualified, trained professional.
Yes. Absolutely. Absolutely. Eliana, you're really, really right. And we need to make people aware of that. What keeps me very positive is that every time I share my views on this topic, and people start asking me questions regarding this, and thinking about this problem, I feel that everyone is interested. No one is left indifferent to this. So people want to help, want to contribute. want to participate, to collaborate. And this is just what you said. It's the starting point. It's the what brings us together, the clue, the glue. We need to move this forward. So I'm I'm confident.
Awesome. Onward together. Thanks for being with us, everybody. And join us for our next podcast. It's coming soon. Check the nciHC.org website for publication and also our page on YouTube. Bye bye.
Bye bye. Thank you.